Welcome to one of the most boring parts of my week. This is the regular Friday COVID-19 briefing for Clallam County with Dr. Allison Berry. They do this at 10 a.m. every Friday. If you're interested in participating, you can ask questions online you go to clallam.net. There's a link at the top that says weekly COVID-19 briefing, and you can raise your hand and join in. Fortunately, this is a fairly short one. I did attend the meeting this morning, so this is my second time through. I'm going to try to make this interesting enough to make it through. In the top, that's Allison Berry. The man talking is Ron Cameron. They're joking around. I think this is officially before the briefing. I don't know who the woman on the left is. No idea what they're talking about right now. And I think this is before the briefing officially starts. I think that's Ed is the Zoom guy. Just real they're casually segregating 30,000 local residents from bars, restaurants, gyms, and other public places. While bankrupting those places, more or less. Notice Ron doesn't have his mask on. So that's, put it on for the official briefing, but, he's obviously not somebody who's quite going along with the program as much as Barry and this other lady.
We'll do our best to get to everybody on the line. That isn't always the case because time goes by. But we ask you, if you want to call in and ask a question, try to limit yourself to a question and limit your comments so that we can get to everybody, because we have other things to do, especially on Fridays and stuff, and our schedules are tight. So
I'm sure they are, bud. Anyway, though, he does. This is partially because I was iced out of the last meeting. They skipped my question. And Ron indicated to me that it wasn't intentional, and I believe him. Prepare to be bored.
Hello everyone, my name is Dr. Allison Berry. I'm a health officer for Clallam and Jefferson counties. Starting as we do with the numbers, our total number of cases at this point in the response is 4,870.
So this is just a rote recitation of how many people have died. And how many people have gotten sick, died, and stuff.
That is an improvement from last week when we were plateauing in the low.
I think we're at 60 deaths in a year and a half in one of the oldest counties in America. Long way from a.
Currently hospitalized with COVID-19. 6 of those are at Olympic Medical Center.
Long way from a.
219 hospitalizations so far in this response. We have lost 60 of our citizens due to COVID-19.
There you go, 60.
And 83% of our cases are among those who are unvaccinated.
Oh, real quick, that's going back to January or February. So what they do is they load that number up with people with a lot of time when there was no vaccine available. And that number's going down. The number of unvaccinated people, the percentage, is going down. It's been steadily going down. So that's a very deceptive number, an intentionally deceptive number. I've asked Barry about this before, and she's refused to answer. Oh, I accidentally muted. That's right. It's just a bunch of bullshit
anyway. On the west end, we have the case rate is 633 per 100,000.
I mean, you can fucking replace her with a bulletin board.
Up a little bit to 331 per 100,000. And in squirm, we are seeing a small improvement to 179 per 100,000. Not
even a bulletin board. I mean, you can replace her with a single sheet of paper.
Our highest rates of transmission continue to be in the west end. As far as what is driving these cases? Primarily, we're seeing cases among social gatherings.
She doesn't know.
We have some workplace clusters as well. We have 2 long-term care facilities affected. One has only a single case among a patient. The other
Outbreak.
one is the known outbreak that we've been following that has been slowing down, but they haven't quite gotten to the point where their outbreak can be closed at this point.
No fucking idea
We
what that
have
means.
2 churches that have been affected with outbreaks as well.
You know they're going after the churches.
At this time, about 5 to 10 people per church. Yeah. We're also seeing transmission related to school sports and club sports in children.
Yeah. Sports is a big problem.
Many
Now, how they know it's the fucking sports and not the kids in class, they don't. But of course, it's all targeted.
If you're participating in sports,
Yeah.
you want to be particularly cautious about
Yep.
safety when it
Of
comes
course.
to any indoor activities. So if
You look at this group. Do they look like they participate in sports? I mean, maybe Ron years ago, but of course, sports is offensive to people like this. And she doesn't have a fucking clue where they're getting it, whether it's sports or whether it's in the fucking classroom or whether it's at some, gathering afterwards. She doesn't have a clue. There's no possible way to actually track that.
In those spaces, we can really reduce the amount of transmission.
You're masking indoors.
Our schools continue to be incredibly safe.
Incredibly.
We have now had
Favorite
4
word.
instances of in-school transmission related to in our county. Each of those have been limited to a maximum of 3 cases due to the incredibly good work we're seeing at our schools, among our students and our staff.
We play a drinking game.
Really
We drink every time she said incredibly.
We continue to have some of the lowest rates of transmission in our schools that we're seeing throughout the state.
Note that schools are not an issue.
The Clallam Bay outbreak is slowly moving along. We are still seeing additional cases from them, but we only have
0 deaths from that outbreak.
That brings them to a total of 251 cases so far. Of course, the vast majority of those are not active at this time.
Vast. She likes the word vast and very, too.
We are closely following the approval process for pediatric COVID-19.
No, she just said schools are not a problem.
The FDA advisory
But here we go.
has recommended approval or EU.
Now, this is important. Pay attention to what she says about kids and the vaccine. This is coming for your kids, 5 to 12. It'll be approved, and she is dying to unleash this on the children. Despite the fact that she'll say here and she'll say in other places that it's not really a problem with kids. Also note that Mr. Cameron has lowered his mask again.
EUA authorization for the Pfizer vaccine for the ages 5 to 11. The next step
See that inhale?
and then needs a recommendation from CDC or the CDC group ACIP, and then the Western states approval. All those things we anticipate will likely be completed by early next week. We will continue to follow that very closely. We are working on plans with our healthcare partners on vaccinating that population, and
That's your children.
We'll be able to announce those very soon. We're following the approval process and also following
rubbing her hands together. She's rubbing her fucking hands together.
For kids is a third the dose that we've used in older populations.
Like that fucking guy in Family Guy, the old guy.
Distributed from the feds to the state and back out to the county, so it'll be somewhat similar to what we saw in the very first round of vaccinations.
Look at Ron's on his phone. I kind of like Ron Cameron.
I want to make folks aware that we likely will have adequate supplies within 1 to 2 weeks after the approval is passed.
So we're talking weeks. And if you don't think she'll issue a fucking mandate for your kids, you're not paying attention.
As soon as possible if they move forward with approval. Boosters are now widely available for the Pfizer, Moderna, and Johnson & Johnson vaccines throughout our county. There was a little bit of delay from the CDC for what's called a standing order of the vaccine. So if you went to get a booster last week at a local pharmacy and you weren't able to, that's likely the source of the delay. That has been remedied. And so you can go ahead and access a booster at any of our local pharmacies that are offering vaccinations. So if you had a little trouble last week, give them a call again. You should be able
Gotta sell them vaccines, man. She don't quit, does she? She stays right on message.
In our community, 62% of the population as a whole is fully vaccinated. 74% of our adults are fully vaccinated.
So they're way past what they said they wanted to get to. They said they wanted to get to 70. That's herd immunity.
We encourage everyone who hasn't had a
Anybody
chance
who believe
to go
that,
ahead
fucking
and get vaccinated
We got some
We are seeing
beachfront property on Pluto.
cases at the state and county level, and that plateau is very high. What we have seen throughout the pandemic is we see a peak and then a subsequent plateau that's a little higher than the one before. That has happened after each of the subsequent waves. And we are now at the highest plateau we have ever seen. This means that as we move into the holiday season, if we don't get our systems down, we could see a very significant sixth wave that would be very similar.
Narrow view of a long set of data and fitting it into a narrative.
We'd like to do everything we can to avoid that. The best thing we can do to avoid that
Vaccinate.
is get more of us vaccinated. We need about 10% more of our community immune to COVID.
Only 10%, right? Let's see if she's lying about that one in a couple weeks.
Around pediatric boosters. Certainly, we will be following the FDA authorization process and the CDC
Back to the kids.
process closely.
Back to the kids.
One of the key things that I want folks to know is there's a common misconception that COVID-19 does not affect children. And that is not true. COVID-19 affects children less severely than adults in most cases, but it can still affect children quite severely. We've lost over 600 children to COVID-19 in this country.
Now that's using the same accounting they use for COVID. So that means 600 or so children have died with a COVID diagnosis. So, so serious childhood illnesses, leukemia and so forth, if they happen to get that, that COVID diagnosis is around the time they die, boom, that's COVID death. That's cash money, baby. Whereas, if a child had leukemia, got a cold and died, they wouldn't have called that dying of the cold or the flu. That would have been, they would have died of leukemia, complications from leukemia. So 600, and that is using their very liberal, the very wide brush of anyone who dies with a COVID diagnosis. And so how many kids actually died of COVID? It's less, to say the least.
We've seen 67,000 children in this country hospitalized for COVID-19. We don't want that to happen to any of our kids. These vaccines are incredibly effective.
Incredibly.
Very safe.
Very.
We highly recommend them. So
highly.
Reduce the risk of any of our kids.
Fucking adverbs. She's so fucking fake.
So with that, I'm happy to
she couldn't sell a car.
I do have one. Do you have any recommendations for the kiddos this weekend?
There we go.
How they can enjoy the holiday?
I should have touched base on Halloween, so Halloween's coming up this
You don't know what a base
It is very
is.
possible to do Halloween quite safely. Trick-or-treating is very safe.
Very.
Largely an outdoor activity. It's very easy to add a mask if you're in a very crowded outdoor.
Now, the reason she's really harping on the outdoor stuff is because there's this famous picture of her going around where she's seen in a group of people that's not part of her family without a mask on. She just happens to be outdoors in that photo. Now, this was after she recommended officially that outdoor gatherings that people wear masks during outdoor gatherings. So that's what you can take from her recommendations. They don't mean much. They don't mean anything to her. But because this photo is being so widely circulated, she's got to constantly emphasize there's this difference between outdoor and indoor. That also kind of ties in with Crab Fest, where it was technically an outdoor venue because they didn't have walls, but people were packed in tighter there than they were anywhere else. But because it was outdoor, quote unquote, it's whatever. It's only, you don't need to wear a mask. Now, again, that contradicts what she said at one point, but and by said I mean in an official capacity. But again, she's trying to cover her own ass right now, and you'll hear a lot in the next couple minutes about the difference between indoor and outdoor.
Setting. But if you're just going door to door and not going into any houses, that's really something that can be done.
It's a huge difference, right?
I encourage our kids to get out there, go trick-or-treating. That's a very safe activity. If you're going to be in a very crowded setting, if you're
Ron's got him a phone.
Events where you're seeing a lot of people kind of bunched up outdoors, we would recommend having a mask in that context. But
recommend, so she will recommend it for outdoors, unless it's her, and then fuck you and your kids.
The one main thing we want to caution folks about is the indoor component. So I've seen some haunted houses are coming back. That can be done well, but you do have to wear a mask when you're indoors. So if you're going into a haunted house,
you definitely do not have to. She cannot enforce it. I walked into this meeting 3 weeks ago without a mask on. There is no possible way for them to enforce it. I can walk into her meeting and she can't enforce it.
Indoor parties is where we saw a lot of transmission last year. So if you're going to go to a Halloween party, I encourage everybody to be vaccinated before you go.
Did you hear the fucking the inhale? Gotta sell them vaccines.
Outdoor trick-or-treating can be done really well, really safely. I plan to get out there myself.
The fuck if you are. The fuck if Allison Berry is walking the streets of Port Angeles on Halloween. The fuck if you are.
One thing I've been hearing a little bit around the edges.
Now she'll probably go. Maybe she'll go to some friend's house or something. She's got any parents maybe. They haven't fucking disowned her ass. Creepy Nazi fucking ass. But she's definitely not walking around hanging out with the fucking population.
Is what's called a sublineage of the Delta variant that we are monitoring.
Delta variant plus.
Local, state, and federal.
Brando called it.
We've primarily seen this. It's a bit of a variant of the Delta variant, for lack of a better word, and we're seeing that primarily
Science.
in the UK. Right?
That's some deep science right there.
There is some suspicion that sublineage is part of what is driving the rise in infections that you're seeing in the UK at this point.
Mostly highly vaccinated UK.
In the United States and in Washington State, primarily in the Seattle area. We have not had any documented cases of this.
Also highly vaccinated area.
It's really in the monitoring and study stage. It's not clear yet whether or not that sublineage will turn out to be more transmissible or able to overtake the Delta variant, but we are following it really closely because that possibility.
Who's we?
You also touched on, I guess, the sixth wave.
I guess this guy gets 2 questions.
What are the prospects about that?
I do think it is highly likely that we
Highly.
will have some sort of a sixth wave in the holidays. Our biggest wave last year was the holidays-related wave. It's a time that we travel. It's a time that we get together.
Now, a couple weeks ago, she said tourism doesn't drive COVID. When it was convenient, the reason she said that is because I asked her if the reduction in cases and the reduction in positive tests would be predictable with the reduction in the people coming in and out of the area and fewer reunions, parties, weddings, and so forth. And she said that doesn't drive COVID, but now that we need to see a bump, now it does drive COVID.
And we're vaccinated before we travel. We wear our masks for indoor gatherings, especially indoor gatherings where you don't know that folks are vaccinated. I think we can really blunt that way. Certainly, I would recommend avoiding travel if you're unvaccinated, including unvaccinated children. Taking a small child who's unvaccinated on a plane with other potentially unvaccinated people does really increase their risk. And be really thoughtful about those family gatherings.
The non-existent risk.
It's very normal and understandable that we want to get together for Thanksgiving. I really encourage.
She's such an. Of course, fellow humans, we want to get together for Thanksgiving.
If you have unvaccinated kids, thinking about how many other unvaccinated kids are going to come in contact with that child.
Think about it.
Many
Filthy kids.
have,
That's what I posted. I post stuff in the chat. Next time I'll screen grab the chat too, because I'm just posting stuff in the chat the whole time she's talking. Not that much, but here and there.
Fully vaccinated aunt and uncle who wants to come to your Thanksgiving gathering, I think that's very reasonable as well. But adding a large number of unvaccinated people indoors for Thanksgiving would really drive up.
Who gives a fuck what you think about what people do for fucking thing? Nobody fucking cares. That's the other thing. She thinks people listen to this. It's like, no. So that guy got to ask 2 questions.
So we have Jesse on. Okay, Jesse, go ahead, sir.
So this is me, and unfortunately my audio's not working. And this goes on. Now, me and Allison do not get along. I've been... So my audio's cutting in and out. And I don't think that's their fault. I think that might be my fault.
Very faint.
We are going to transition to one question per person.
Yeah, now, she asked the last guy, I got to ask 2 questions. But it's only one when I get to ask. Again, this is because I've been laying into her. I've been absolutely fucking roasting her. I send her emails. I got this meme going around.
It must be moving, Jesse, because we're not...
I'm not moving, but yeah, there's audio problems, and this I think is my bad, so... But, unfortunately...
Faint, but better.
Yeah, at least we can really get
Unfortunately, this goes on for just a little bit. I think I might just skip ahead because it just doesn't work.
Oh yeah, you can type a question into the chat.
Can you put it into the chat?
Yeah, and this is what I usually do. Okay, and they do kind of they do work with me. I mean, Allison doesn't want to. You'll be able to tell at the end.
Tries to work on that. For the EOC,
But certainly Mr. Cameron does.
we had over 800 show up at our clinic last weekend on last Saturday at the high school for booster shots with Moderna.
These are old people, I assume, mostly.
That really marked the end, at least for the moment, for emergency management's contribution from mass vaccinations. Because the vaccine is so widely available, especially now that the standing orders come through and everything, you can go to just about any pharmacy. A lot of clinics are giving it to their patients. So it's very easy to get the booster if you want it. There's just not much need. I guess it's official now that OMC is going to work on
That's the hospital.
getting, those younger kiddos that are eligible to get the shot and get them done, taken care of. Obviously, we'll always be on standby.
Oh, the hospitals, yeah. Pretty predatory hospital system. In certain ways. In certain ways, they're good too. But yeah, I'm sure there's elements there that are just dying to get to these kids.
So we're going to be around, but as far as an intimate partnership, I guess we're kind of backing out a little bit. State EOC, we have been throughout this process.
Yeah. So yeah, okay. I'm gonna skip.
We're backing out. I think that's it. The lovely Annie.
Now I get my question in here, but she doesn't answer it. But she does squirm.
The state PPE distribution, they said they will still help if there's a large agency outbreak. It's just the general distribution of PPE that you get doing.
And again, we're still in that, we're just more in the system mode and more of a support mode where before we were kind of in a leadership role and we're just in a different mode now. But we're going to be available to help whatever it needs. Of course, if it rallies up again, like it has before, so will we.
Mm-hmm. So we're out of, I suppose, a state of emergency.
Would you get back online?
His questions are, can the vaccine kill children, yes or no? How many children in Clallam County have died of COVID-19? Just a number, please.
Sure. There is a common
So she doesn't answer the question, by the way. Spoiler alert. It can kill children. She knows it can kill children. She's admitted it that it can kill people. And in Washington State, we recently had a fairly young woman, healthy woman, die. She knows for a fact it can kill children. But all I asked was a yes or no. Now I'm going to put that question to her again, but watch, she won't answer.
There have been no cases of pediatric death.
That is not what I asked.
I just want to be super clear about that.
Super clear.
No children in Clallam County so far have
Zero.
COVID-19.
So they want you to, it's essential that you vaccinate your kids with a potentially deadly vaccine that has killed no one.
We're grateful for that. That is luckily
It's essential.
The best way that we can ensure
And look at her
that
rubber hands, man. She would not be a good poker player.
reduce the number of cases among
She's just lying.
One of the things that
And she rubs her hands when she lies.
We don't have to look very far to see examples of large numbers of kids getting hospitalized or
Blah,
going
blah,
to
blah.
ICU or unfortunately even dying.
But we got to look here. I asked her about hair. I didn't ask her all this bullshit.
Earlier this summer, we saw pediatric ICUs filled with children who had COVID-19, and that is a tragedy that
Blah,
is
blah, blah.
entirely preventable. 97% of the children ever hospitalized for COVID-19 were unvaccinated. 70% of the children who were hospitalized had some underlying condition, but that was
It's funny how they like to talk about underlying conditions when
30%
they're
of children hospitalized for
trying to
COVID-19
downplay the
had
issue.
No other underlying condition at all. These were healthy kids who were hospitalized and ended up on ventilators for COVID-19. We don't want that to happen here. And so far,
Why hasn't it happened here? Why are you talking about some place that's not even related to my question?
We've been partnering with our schools to protect our kids. In places where we've seen schools not following COVID-19 safety protocols, where kids are unmasked, Kids are gathered really close together. You see a massive wave of pediatric infections. And unfortunately,
Massive,
a
yeah.
subsequent
Not
wave
in
of
Florida,
pediatric
though, oddly enough.
hospitalizations. We've been able to prevent that here because of the incredible work of our schools,
Incredible.
our parents, and our kids.
I don't even know if she knows that incredible means not credible.
So we just really want to keep that moving forward. The next biggest thing that we can do to keep our schools safe and keep our kids safe is to get as many of our kids vaccinated.
Why? It's already safe. Why does it need to be safer? We've had no serious outbreaks. There's been no serious outbreaks. There've been nobody's going to the hospital and nobody's dying. Why do we need, how much safer can it be? Right? It doesn't have anything to do with safety. It has to do with vaccinating them kids.
Thank you so much.
This is who's in fucking charge. That's the end of it. Alright, now look, you can show up for this meeting. You go to clallam.net, click that link, weekly COVID briefing, 10 o'clock. Show up and ask questions. If I get any response to this video at all, I'd be happy to provide or suggest a few questions. It's important to keep the questions concise. Notice my questions were concise. It would have been better if I could have spoken them, because I could have emphasized certain things and cut off where I knew she wanted to go with this sort of blathering, blah, 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 complete nonsense that didn't have anything to do with the question that I asked. But it'd be nice, there's only a couple people that I was the only one that asked a real question. The guy that got to ask two questions, of course, was, this softball stuff. But we can put hard questions to her, and you can see how she squirms. Oh, did she say? Oh, I missed a part, though. Wait, I gotta go back.
We already talked about it.
So much.
Okay.
Any other questions on them?
That didn't answer his question. He's asking if
I don't know that we need to keep engaging with Mr. Farmer.
You hear that? I don't know that we need to keep engaging with Mr. Farmer. That's because she's definitely does not like me, and I've been super hard on her. But that's what you get. That's what I get. You push the hard questions to her, you can see how butthurt she gets. And the more butthurt this person gets, this is not a strong person. This is a person that has a lot of support from her, corporate sponsors. I'm not exactly sure how it works, but, this is somebody that if she had to answer 10 hard questions in one of these briefings, you would see her continue to break down. And that's what we need to do. And we also need to get her on record admitting as much as possible that, first of all, there's no danger to kids. There's no reason to vaccinate them. There's certainly no reason for a mandate. And we can talk about the muzzling of children and the abuse that is. We can talk about the dangers of the vaccine. Now, they want to downplay it all the time, like, oh, it's not that dangerous. It's not as dangerous as COVID. Well, that's not your decision to make, bitch. That's why we have informed consent. That's why we hanged a bunch of Nazis. No exaggeration. People have a right to make a choice whether they're going to take a potentially deadly drug that she has admitted, I've gotten to her admit at least twice, that it is deadly, that it can kill you. But she's going to make the fucking choice. That person right there in the middle of the fucking street is the one that's making those choices for you and your kids. Fucking just show up.